Good morning. I'm Stephen Aquario, the Executive Director of the New York State Association of Counties. Really happy so many of you were able to carve out some time and join us for today's session on really how to maximize FEMA reimbursement and really, what's more importantly, the process for obtaining federal aid for COVID expenses at the county level. After all, we are the government that is responsible in large part for combating the enemy, preparing our community, testing our community, vaccinating our community, educating our community, and informing our community. And in order to do that, local government officials, county officials more specifically, have been scrambling for 2 years now, trying to figure out how to best do this. So on behalf of our president, the Honorable Martha Sauerbrei of Tioga County, New York, the chair of the Tioga County Legislature, I want to thank you for joining us this morning for this webinar again on FEMA reimbursement. On the 20th of March last year, the president declared a major disaster declaration for the state of New York. That was DR 4480. That was related to the COVID-19 pandemic response. This triggered federal funding for local governments and certain eligible private not-for-profit organizations in all of our counties. Today's webinar will give a brief overview because many of you are fairly sophisticated in FEMA reimbursement, but nonetheless, we have asked our partners at IEM here today to talk about a brief overview of FEMA Public Assistance. Why? Because a refresher never hurts. And for those of you who haven't been exposed because you're relatively new in government, we thought that it would be very important to have a brief overview of public assistance reimbursement guidelines with a focus on common pitfalls or concerns identified by counties in the state of New York, and also provide an opportunity for an open discussion with the IE team at the end of this webinar. This webinar, the PowerPoints that you're about to see was custom built by NYSAC through IEM for your review. This was not something that IEM did on their own and came to us. We actually worked with them based on the feedback of counties of what we know people need to hear. So this is a customized program for your information. And it's important to note at the outset of this discussion that any cost tied to IEM or consultants to help you with your FEMA reimbursement, if your county were to procure their services, are 100% FEMA reimbursable. And I've personally asked IBM to talk more about this in their presentation. But before I introduce our speakers today, I want to take a quick moment, a quick shout out to thank the New York State Industries for the Disabled, NYSAC, as our sponsor for today's webinar. We are partners with NYSAC for many, many years, and their president, Maureen O'Brien. Of course, NYSAC provides essential procurement options to county governments for high quality custodial document imaging, mailings, mail fulfillment, and other services to a new e-commerce storefront. Your purchases help actually provide employment opportunities with persons with disabilities in your community all across the state. So thank you, and a great shout out to NYSAC. If you have any questions during the presentation, at any time during the presentation, type it right into the chat box, and we'll get to that question either during the presentation or at the Q&A section that we have at the end of our program. We're going to try to go about 40 minutes or so, 45 minutes with the presentation, leaving time for discussion and Q&A at the end. And again, want to thank IEM for providing this educational session to the members today. They work in state emergency management offices all across the United States, as well as county governments, local governments, cities, and emergency management all across the country. I'm very happy to announce our speaker today, Michelle Jones, Project Manager for IEM. Michelle is a dedicated professional with a strong experience in emergency management, planning, communications, Currently serves as project manager, as I mentioned, for IEM, graduate of Central Florida, has a master's of public administration with a concentration in emergency management and homeland security. At this time, I'll turn it over to Michelle, and her colleagues James Clark and David Andrews will also be on the presentation at the end for questions and answers. So let me stop there and go right to Michelle. Michelle, thanks again for joining us.
Good morning, and thank you for the opportunity to talk through the FEMA reimbursement process with all of our counties and folks on the line. And thank you again to the sponsor. We're thankful to be able to partner with NYSAC on this important topic. And thank you, Steve, for the warm welcome and introduction. Today, I'm going to share a little bit about IEM with you and then move into a brief overview of the public assistance process. I will discuss some eligibility considerations for your COVID-19 expenditures and the current policies, then the important considerations tied with duplication of benefits. You know, a lot of communities have received CARES Act and the American Rescue Plan Act funds. So we'll talk a little bit about how those tie into the FEMA reimbursement process, and then quickly touch on the COVID-19 simplified application process, review best practices and recommendations, and then, like Steve mentioned, to open the floor for questions. Next. So IEM was founded in 1985, making it the largest woman-owned emergency management company in the world. We have directly managed statewide and local disaster recovery programs while maintaining decades-long relationships with FEMA, the United States Department of Housing and Urban Development, and other federal agencies. As a dedicated emergency management firm, IEM has continually demonstrated the capacity to provide top-level talent for our state and local partners, retaining and developing personnel at all levels of experience, while also providing accountability and transparency both to and for our clients. We produce consistent, high-quality deliverables that meet stringent standards defined by FEMA, HUD, and other federal granting agencies, as well as our state and local partners. Next. In the unprecedented COVID-19 emergency management landscape, where the virus, political forces, and resource constraints continually change how we successfully plan and manage this response, the need for comprehensive expertise in emergency management is critical. Firms like ours who understand all stages of emergency management are increasingly in demand as state and local governments look to ally with partners who can provide full life cycle support. And then at the same time, new federal grant programs such as the American Rescue Plan Act becoming more integrated with one another as lawmakers look not only for cost-saving measures, but for increased efficiency in disaster funding. By finding synergy between disaster planning, response, mitigation, and recovery, recipients of federal grants are able to leverage their funding to ensure the safety and security of their residents. IEM is uniquely equipped to help meet these ever-growing challenges head-on. As a dedicated emergency management firm, IEM's entire business portfolio centers in and around disaster preparedness, protection, response, recovery, and mitigation. IEM has been on the ground supporting customers from the earliest days in New York City to Florida and Illinois. We are now directly supporting clients of varying sizes and types, such as state, county, city, community, private nonprofit organizations, and hospitals across the country that are navigating the COVID-19 response, as well as providing support for recovery to include FEMA reimbursement. With each project, IEM learns best practices we can bring to another customer. IEM's developed an information sharing network so that our response and recovery consultants can share what they are doing and learning quickly so the next customer can take advantage of that gain. The emphasis on information sharing is how we increase our capacity to serve. As we continue to expand our network, we are proud to partner with the New York State Association of Counties to bring this webinar to you. Next, please. To briefly go through the public assistance process, public assistance, the Robert T. Stafford Disaster Relief and Emergency Assistance Act, known as the Stafford Act, authorizes the presidents to provide federal assistance when the magnitude of an incident or threatened incident exceeds the affected state, territorial, and local government capabilities to respond or recover. Next. On March 13, 2020, the president declared a nationwide emergency to avoid governors needing to request individual emergency declarations. All 50 states with a total of 101 emergency designations to assist with additional needs were identified under the nationwide emergency declaration for COVID-19. Additionally, 89 tribes are working directly with FEMA under the emergency declaration. As part of this major disaster declaration, the President authorized the Public Assistance Program for emergency protective measures. The Public Assistance Program is a reimbursement program that provides federal funding to help communities respond to and recover from disasters such as COVID-19. FEMA will reimburse state and local governments and certain types of private nonprofit organizations for the cost of disaster-related eligible items. FEMA's Public Assistance Program and Policy Guide provides an overview of the Public Assistance Program, the policy language used to guide eligibility determinations, and a synopsis of the Public Assistance Program implementation process, beginning with pre-declaration activities and continuing throughout the closeout of the PA program, as well as checklists which can be used to document throughout the response and recovery phases of the incident to help substantiate claims for assistance. It's important to note that version 3.1 of the Public Assistance Program and Policy Guide is applicable to all COVID-19 declarations. FEMA has since come out with a version 4, but that policy guide is not applicable for the COVID-19 event. Next. As this public health emergency continues or began to get underway, the President approved a major disaster declaration for the entire state of New York on March 20th, 2020. FEMA assigns a number to every federally declared emergency or disaster, and the disaster number for this COVID-19 incident is DR4480. The disaster declaration designates the incident period, which is the time span during which the disaster-causing incident occurs. The incident period for this declaration started January 20th, 2020, which means eligible expenditures for activities conducted on or after January 20th, 2020 can be submitted to FEMA for reimbursement. The incident period for this disaster is currently open-ended. Once FEMA establishes an end date for the incident period at some point in the future, FEMA will announce that information. But at this time, there's no closing period for when expenditures may be eligible. This disaster declaration covers Category B emergency protective measures, which we'll cover in more detail in just a few minutes. Currently, the COVID-19 major disaster declaration, for this disaster declaration, the federal portion of the public assistance cost share is 100% of eligible costs for projects within the Category B emergency protective measures guidance. Cost share is also known as the non-federal share or match, and it's the portion of cost of a federally assisted project or program not borne by the federal government. The total cost to implement the required eligible disaster activities is generally funded by a combination of federal and non-federal sources, so state and local. However, for COVID-19, the 100% federal cost share has been approved by FEMA policy through December 31st, 2021, and FEMA has been directed by the President to extend that through April 1st of 2022, and we're awaiting updated FEMA guidance to reflect the President's memo. When these slides are shared, as mentioned in the chat, you'll find an appendix at the end of the slide deck with links to all current COVID-19 policies, guidance, and fact sheets. Next. There are 4 building blocks of eligibility for FEMA public assistance, and all 4 tiers must be eligible to obtain FEMA public assistance funding. Sometimes there are complex eligibility questions which may occur, and for those situations, it's important for FEMA and the applicant to document the analysis required related to the eligibility determination. Next. The first hurdle for eligibility is determining whether the applicant itself is eligible. Only eligible applicants can apply directly to FEMA for public assistance reimbursement. State governmental agency, county governments, municipalities, cities, towns, and townships, tribal governments, special service districts, school districts, and certain private nonprofit organizations are all eligible applicants. Critical private nonprofits, such as medical facilities like hospitals, outpatient and rehabilitation facilities, laboratories, custodial care facilities that provide institutional care for persons who require close supervision and some physical constraints in their daily activities, education facilities such as primary and secondary schools, colleges and universities, emergency facilities such as fire departments, rescue squads, and ambulance services are also considered eligible. Essential but non-critical private nonprofit organizations such as community centers, child care facilities, food assistance programs, senior citizen centers, homeless shelters, performing art facilities, and houses of worship may also be eligible. The private nonprofit organizations must have a letter from the IRS granting a tax exemption under sections 501C, D, or E, and they must have documentation from the state substantiating that the non-revenue producing organization is a nonprofit entity organized or doing business under state law. Organizations that do not meet the definition of an eligible applicant, for example, for-profit hospitals who are performing eligible work on behalf of an eligible applicant, may seek reimbursement of costs through the applicant if there's an MOU in place. So for example, if you're partnering with a for-profit hospital to provide testing, the hospital's work itself would not be able to, the hospital itself would not be able to seek reimbursement as a for-profit entity. But if the county or community had a MOU in place with the hospital, then there's the potential to seek reimbursement through the county. The second tier is facility. So a facility is a building, work, system, or equipment built or manufactured or an improved or maintained natural feature. Due to the COVID-19 public health emergency, there's no anticipated damages to facilities. Then we look at work. To be eligible for public assistance, an item of work must be required as a result of the declared incident and must be located within the designated disaster area or within the county. Must be legal responsibility of the eligible applicant and must be done to eliminate or lessen an immediate threat due to the COVID-19 public health emergency. Next. As we mentioned earlier, there's two categories of eligible work available to applicants during the COVID-19 public health emergency. The first is category B, emergency protective measures. We'll review the current FEMA policies to give you a better idea of potentially eligible costs directly related to the COVID-19 public health emergency, which would fall under the category B, emergency protective measures. The second is category Z, management costs. As Steve mentioned earlier, administrative costs incurred in the preparation of a FEMA project application or for all projects submitted under one disaster would fall under this category Z, management costs. Under the category Z project, FEMA may provide reimbursement for an applicant's administrative expenses up to 5% of the sum of all costs obligated through the category B projects. Category Z costs are funded at 100% cost share. Through this category Z project type, IEM can assist communities with no upfront costs to applicants. IEM would be able to work with your community to determine potentially eligible costs and collaborate with you throughout the process of project application to obligation to reimbursement. IEM manages a broad portfolio of government contract vehicles to provide our clients with fast, flexible channels to access the full range of IEM services. And on this slide, you'll see links to both our contract vehicles, and one of those is GSA, so the ordering procedures recommended for GSA. Next. The final element of the eligibility pyramid are the costs claimed by the applicant, which we'll dig into a bit. We recognize how confusing the various policies provided by FEMA throughout the pandemic have been. However, we have happy news to share. The updated safe opening and operations work eligible for public assistance supersedes the previously released guidance and now applies for work conducted through January 1st, 2020 to December 31st, 2021, and also establishes that 100% cost share from January 1st, 2020 through December 31st, 2021 for all of the eligible work performed. And as I mentioned before, there is a presidential memo directing this 100% cost share period be extended until April 1st of 2022, but we're still waiting on the update to FEMA policy for that. It is important to note that the safe opening and operations work eligible for public assistance policy identifies that all work must be required as a direct result of the emergency and done in accordance with CDC guidance or that of an appropriate health official at the time the work was completed. The emergency protective measures must be necessary to save lives and protect health and safety. Next. This updated safe opening and operation work eligible for public assistance guidance defines the framework, policy details, and requirements for determining eligibility of safe opening and operation working costs under the public assistance program. And again, applies to work conducted from January 1st of 2020 to December 31st of 2021. So you don't have to worry as much about the different timeframes of various policies that we had experienced previously. All work, as you can see here, the purchase and distribution of cloth face coverings and PPE, cleaning and disinfection of eligible facilities, COVID-19 diagnostic testing, screening and temperature scanning, acquisition and installation of temporary physical barriers, and social distancing signage, the purchase and storage of PPE. Those are all specific work activities and associated costs that are clearly eligible. Next. The safe opening and operations guidance also reconfirms that the work eligible for public assistance policy guidance is also eligible throughout this time frame. This policy identifies medical care, purchase and distribution of food, and non-congregate medical sheltering, all of which have their own specific policies, with which you will find links to in the appendices whenever these slides are shared. They also reconfirm the operation of Emergency Operations Center to direct and coordinate resources, communications to disseminate public information, including efforts to make your public information more available to a wider audience in various languages or using translation services are eligible. Mass casualty management, purchase and distribution of PPE, law enforcement security, training and technical assistance specific to the event, reimbursement for overtime costs, which we'll talk a little bit more about, movement of equipment and supplies, and then other working costs delineated with those COVID-19 policies, medical care, purchase and distribution of food, and the non-congregate medical sheltering are eligible. Next. The medical care policy outlines eligible work and associated costs to support the distribution and administration of COVID-19 vaccines, which may be eligible. Since the federal government will provide the vaccine itself at no cost, costs incurred to support the distribution and administration of the vaccine are not eligible. This policy also since the federal government will provide the vaccine itself at no cost, the vaccine is not eligible, but costs incurred to support the distribution and administration of the vaccine is. So this policy also provides a job aid, which applicants must take to document that the pandemic response and recovery efforts are conducted in an equitable manner to communities of color and other underserved populations, including sexual orientation and gender identity minority groups, persons with disabilities, those with limited English proficiency, and those living in the margins of our economy. This policy includes specific reporting requirements for vaccine administration consistent with the equitable pandemic response and recovery. Next. Additional details on utilizing hospitals and the medical care policy, purchase and distribution of food, non-congregate medical sheltering are available in the appendices, as I mentioned. Looking at duplication of benefits, the Stafford Act provides that no entity will receive assistance for any loss for which financial assistance has already been received from any other program, insurance, or other source to address the same purpose. The COVID-19 declaration makes clear that FEMA Public Assistance Fund may not duplicate assistance provided by the Department of Health and Human Services or the Center for Disease Control and Prevention, the CDC. Given the need to quickly address the public health threats of the COVID-19 pandemic, and that Congress has made funding available to several federal agencies for this purpose, potential applicants for PA have the flexibility to determine which source of funding to use for their costs in order to best meet their needs in response to the COVID-19 pandemic. subject to the purpose and eligibility requirements of each of the federal programs and funding sources. So given the multiple overlapping authorities and funding for the federal response to COVID-19, FEMA may provide PA funding to applicants for eligible costs under the COVID-19 declarations that may also be eligible for funding under another federal agency's authorities, as long as there's no duplication or identification that the county or applicant is using funds, two funding streams to cover one expenditure. However, to avoid confusion and streamline options amongst multiple funding sources, FEMA may decide not to pay for certain types of work and instead may direct applicants to another agency with more subject matter expertise or with a more flexible funding source if identified. So for example, contact tracing is potentially an eligible PA emergency protective measure in coordination with the Department of Health and Human Services and Department of Treasury. However, FEMA has determined that those agencies are the most appropriate for applicants seeking funding for contact tracing. And so would likely redirect that request for funding to one of those agencies. For eligible costs covered through the American Rescue Plan Act, costs may be submitted to FEMA reimbursement. We do recommend utilizing the American Rescue Plan Act funding to serve your communities and build programs to continue to help build your communities back from COVID-19. FEMA PA funding, public assistance funding, should not be considered a funding of last resort, but should be considered concurrently with these other federal agency programs and sources. And once FEMA has awarded public assistance funding for these costs, the eligible expenditures should be moved to a separate sub-account for tracking of federal public assistance funding and to ensure backup documentation is compiled in a place easily accessible, stored electronically, and organized so that when audited, the information is readily available. Next. Local governments and private nonprofits must meet the more detailed requirements set forth in 2 CFR 200, including procurement transactions shall be conducted in a lawful and ethical manner. Unnecessary duplicative purchases are not permitted and not reimbursable. Whenever possible, consider leasing versus purchasing. Enter into agreements to share common goods or services with other government entities, nonprofit organizations, or educational institutions when possible, and consider breaking purchases into smaller consignments or consolidating purchases if doing so will lower pricing or provide a greater value. When seeking to use either the small purchase or micro purchase methods, applicants must avoid the intentional splitting of purchases or transactions to circumvent the dollar threshold limitations. Procurement by micro purchase is the acquisition of supplies or services, the aggregate dollar amount of which does not exceed the micro purchase threshold, which is currently set at $10,000. Micro purchases may be awarded without soliciting competitive quotes if the price is reasonable. To the extent practical, micro purchases should be distributed equitably among qualified suppliers. Small purchase procedures are those relatively simple and informal procurement methods for securing services, supplies, or other property that do not cost more than the simplified acquisition threshold, currently set at $250,000. 3 price quotes should still be obtained and documented from qualified sources for these expenditures. However, if your local procurement guidelines are more restrictive than these outlines, then that is what the applicant must follow. Next. Large purchases should be competitively purchased either through competitive sealed bidding or competitive proposals. Bids are publicly solicited and a firm fixed price contract, a lump sum or unit price is awarded to the responsible bidder whose bid conforming with all the material terms and conditions of the invitation for bid is lowest in price. On the other hand, the technique of competitive proposals is normally conducted with more than one source submitting an offer, and either a fixed price or cost reimbursement type contract is awarded. It's generally used when conditions are not appropriate for the use of sealed bids. And then sole source purchases are allowable when such purchases meet the guidelines as outlined and are properly justified and documented. Do keep in mind that you can also use federal supply schedules such as GSAs, as previously mentioned. State and local governments, including local, regional, or tribal government or any instrumentality thereof, may utilize the federal supply schedules, but they must follow the GSA ordering procedures. Next. FEMA refers to an applicant's looking at the cost eligibility. As we dive into each of those specific expenditures, we wanted to provide an overview of the different types of costs, considerations on whether or not they're generally eligible, and then the documentation that would likely need to be maintained for each of those. So FEMA refers to an applicant's personnel as force account labor. Force account labor includes the county's personnel costs based on the actual hourly and overtime rates and the cost of the employee's actual fringe benefits. The fringe benefit cost is based on a percentage of the hourly rate, but since certain items in the benefit package are not dependent on hours worked, the percentage for overtime is usually different than straight time. Labor rates must be based on the applicant's pre-disaster labor policy that's uniformly applied, and typically only overtime is eligible for budgeted employees. FEMA refers to an applicant's property, tangible property, including information systems, which have a useful life of more than 1 year and a per unit acquisition cost that equals or exceeds $5,000 as a force account equipment. Reimbursement is based on FEMA hourly rates or mileage if available. With leased equipment is specifically leased to support the disaster operation when it's more cost effective to lease rather than purchase the item, and reimbursement is based on the terms of the lease. Next. FEMA considers materials and supplies to cover any applicant-owned tangible property not meeting the definition for force account or leased equipment. So depending on whether the items were purchased or taken from stock will impact the type of documentation needed. Reimbursement will be based on invoices, if available, from purchasing or replenishing stock. If not available, FEMA uses the applicant's established method of pricing inventory or historical data and/or prices from area vendors for materials and supplies taken from stock. All contracts must show they comply with federal procurement standards as a condition of receiving PA funding for contract costs for eligible work by using their own documented procurement regulations, which conform to applicable federal, state, and local law and procurement standards. And as mentioned before, when there is a difference between them, the applicant must follow the most restrictive rule. Next. FEMA is simplifying the public assistance project development and application process. They have created a COVID-19 simplified application process, which enables FEMA to eliminate many application steps that are designated, such as eliminating exploratory calls, recovery scoping meetings, site inspections, and reducing some of the documentation requirements. Next. The first step to work through this process is to review or attend an applicant briefing provided by the New York State Department of Homeland Security and Emergency Services. Then, if you do not already have a grants portal account, you'll need to register for FEMA's grants portal, which is where you will submit the documentation and approve, monitor, and manage your PA projects. FEMA offers a 45-minute applicant basics webinar, which walks through this process, provides a screen of the grants portal itself, walking through step-by-step to provide increased familiarity with the system, and a link to that video will be provided in the appendix when the slides are shared. Once you're logged into grants portal, you'll have to submit your request for public assistance if you have not already. Those requests will follow a standard review process by the state and FEMA, and you'll be able to view your request status in grants portal. Once your request for public assistance is approved, you'll be ready to submit projects for reimbursement. FEMA also has a streamlined project application webinar available, which will take you through the steps of submitting the application, and you can follow along with it at your own speed. The link to that is also included in the slides in the appendices. The application includes detailed information about the activities for which the applicant is requesting funding and lists supporting documentation the applicant will need to submit to justify the request. Once all required documentation is uploaded and questions are answered via grants portal, FEMA and the state will conduct a thorough review of the documentation provided. The project status will update to pending CRC development, and that means the application has been routed to staff at the FEMA Consolidated Resource Center, or the CRC, where FEMA specialists will review the scope and costs and then validate and review the information in the project application for compliance with all applicable laws and regulations. Once FEMA and the state have approved the project, the grants portal system will send a notification to the applicant, and the application is ready for review. This is where you do your final review of the expenditures, sign the final grant, and then you'll have a firm understanding of the amount of funds you may expect to be reimbursed. Next. We wanted to quickly provide some best practices and recommendations for your consideration as you continue to move forward with the COVID-19 reimbursement process. Next. We do recommend keeping track of other sources of disaster funding to avoid duplication of benefits. As I mentioned before, it's great to be able to have your American Rescue Plan Act in one chart of accounts, and then your disaster public assistance reimbursable funding in another, so that down the road, as audits do occur, you're able to clearly delineate where those expenditures were separated. We also recommend setting a regular schedule for submitting reimbursement requests. So if you have not to this point submitted any, perhaps do so in 6-month periods, and then moving forward, depending on the amount of expenditures, either in 3-month or 6-month periods. If you are planning to move through this process on your own, we recommend watch those grants portal and streamline project application videos when submitting projects. That'll help answer questions that you may have. But if you would like assistance or support, reach out to your recovery contractor. We are happy to assist. Next. As you make purchases and expenditures, we recommend writing notes on the receipts and invoices on what the purchase was for and how it was related to the disaster. And if needed, or if the item is going to a specific location, what site it was used at. And that'll reduce later on you trying to remember where you might have used that widget, or where you might have sent that, that testing kit. Collect proof of payment with your invoices and receipts to assist in closeout. You will not need to submit your proof of payment when you submit your project to FEMA, but when you are requesting the funds to be reimbursed after your project has been obligated, you will need that proof of payment. So recommend you collect those as quickly as possible, and then use an Excel spreadsheet to track expenses and include those columns to document notes on how each expense was related to the disaster and whether proof of payment was collected. When you're ready to submit, that'll make it easier to transfer to the FEMA forms. Next. Thank you for your time and participation. I know some have substantial experience because of past impacts of natural disasters, but may have never gone through this process. Once the slides are posted this afternoon, we have also included appendices, the slides.
Well, I want to thank you, Michelle. If you're concluded in your presentation, thank you very much. You have gone through quite a bit. We have some questions. Again, if our attendees want to send in questions, now's the time to do that, and we can take the next 15 minutes for questions. And thank you for putting up the contact information, both at NYSAC and for IEM. There is some contact information there for you. You could also submit to coronavirus@nysac.org, coronavirus, all one word, at nysac.org, and we can help answer some of the questions that may come in. NYSAC has been working for you since March of 2020, right when the pandemic began. We began to pull together the leaders. And now, as we've worked through 2020 and in through 2021 year end, we are very concerned that we draw down as much reimbursement as we are entitled to. And I want to thank IEM in particular, their Chief Executive Officer. Michelle mentioned that this is a certified women business-owned company. Madhu Berriwal is the Chief Executive. Madhu is, through her leadership, is the largest disaster recovery program in the United States right now, working, as I mentioned before, since 1985 in all of the states around the United States. IEM also managed the billion-dollar post-Hurricane Sandy disaster housing recovery, worked in Louisiana for Hurricane Katrina, very knowledgeable and trained in expertise in emergency management. Really appreciate you lending your expertise. In particular, we limited this to COVID. The state also has multiple declarations of emergency right now for other natural disasters, especially last week with the high winds in Western New York and the floods a few months back. IEM can also help the counties and the local government within those disaster declaration counties. A couple of questions here that came in. Can you speak more to whether the typical procurement processes, example, an RFP, can be bypassed during these emergency situations, especially if there are no standby contracts? And also, is piggybacking allowed? So if one county did follow the procedures that you outlined, Michelle, with small purchase or whatever it might be, over 250,000 or under 250,000, and is that that bid, if you will, or that competitive process something that other local counties can use, take advantage of that one county government? Ulster was looking to do this on at-home test kits recently. Can that bidding process be used by other counties around the state?
Yes, absolutely. Great question. So on the first part, when an agency determines that there is a public emergency or public exigency, they can enter into an emergency contract. I would recommend a review of the county, the applicant's emergency policy to see whether there is a waiver that is included, a waiver that would allow you to waive your normal procurement policies. It's important. Generally, that's included in your local state of emergency or the governor's state of emergency. As for piggybacking, generally piggybacking as the term isn't the most favorable, but if there is a cooperative purchasing group, agencies may find it advantageous to use existing contracts of another agency to exercise those contractual rights. Generally, those are recommended so that the various counties involved are represented throughout the procurement process. And then there's also state, local, or tribal purchasing schedules, which are an arrangement that a state, local, or tribal government has established with several or many vendors who agree to provide essentially an option to the state, local, or tribal government to acquire specific property or services in the future. Does that answer that question?
Thank you. Next question. The county hired a billing consultant to bill third-party insurance companies for the vaccine program. Are the billing consultant costs eligible?
Great question. So typically, generally, the increased operating costs for administrative activities such as medical billing are not eligible. However, if the county did not have any such program in place before, had to create the program specifically for COVID-19, there's definitely an argument to be made that that should be eligible. It would just be a matter of having that conversation when submitting the project.
Thank you. Next question. Can IEM help the counties with deciding which expenditures should go to FEMA? Do you have a template that's used to help the counties recreate the local expenditures through 2020 and 2021?
Absolutely. So we've worked with several jurisdictions. I've specifically worked with a county in Virginia where they've pulled their general ledger of expenditures, and we've been able to go through those and identify potentially eligible expenditures. We've also worked with communities looking through the Emergency Operations Center at whichever system they're using, whether that's WebEOC or a different management tool, and looking at the resource requests in there to help identify which expenditures are eligible. We're happy to walk through that process with any county or community that may need that assistance.
Thank you. Does IEM have a relationship with DISHES? The ultimate claim from the county must be approved by DISHES before it gets approved to FEMA. Working through you, if the county worked through you, do you help with the DISHES review?
So we do have a relationship with DISHES. It's more focused in hazard mitigation, and we are providing some support on the financial side, but not directly tied to the COVID-19 reimbursement. So while we have and maintain a relationship with them, we are not in that review process, so there is no conflict utilizing our services on the county side.
You mentioned purchasing under the GSA schedule, which is the General Services Agency, I believe, sort of a federal OGS or Office of General Services schedule. But what about the federal ECAT ordering system contracts? The county official is asking that the ECAT falls under the purview of the Defense Logistics Agency and is used for broader medical supply chain, particularly with an emphasis on military agencies. Any thoughts on that contract?
One moment, let me pull up we have a number of federal contract vehicles, GSA, the HHS Program Support Center, the Defense Information Systems Agencies, Encore 3, and then multiple state contract vehicles. If you are asking specifically if IEM has that contract vehicle, I don't believe that we do based on the question, but if you are utilizing that contract vehicle to purchase other supplies for the COVID-19 emergency, then as long as you're following the appropriate ordering procedures, then that contract vehicle would continue to be open to you.
Okay, the county's saying sometimes we struggle with documentation management and ensuring everything is organized. Can IEM help do this for us if we contract with you?
Absolutely. We provide that level of support across the spectrum. So we've worked with communities to pull the backup documentation, help create those audit ready packages, and then provide that back to the county so that you have that set of information that you can maintain on file for years to come to be prepared for those future audits.
Can you review the procurement procedures, again, available for accessing IEM services?
Absolutely. Jeanette, if you wouldn't mind going back to slide 10, and I don't know if you have the ability to click on the IEM contract vehicles link that is available there. Oh, I'm sorry. Go forward 3 slides. So on this link, you can see here we have the GSA award schedule here. Depending on the amount that you may believe you may be submitting for FEMA reimbursement would require or specify whether or not you would need the 3 additional quotes, whether it's below or above that $250,000 threshold. If you have any questions, and Jeanette, if you wouldn't mind hitting that plus sign for the GSA multiple awards, we are happy to talk through this process with you, provide support so that you can make the best decision for your community.
The next question is, has the federal government changed certain restrictions or deadlines for eligible costs? There seems to be some confusion before September of 2020, after September of 2020 into January 15th of 2021. Are there different phases of reimbursement, or did the federal government streamline the COVID FEMA eligibility rules?
So thankfully they have streamlined those rules. You're absolutely right. Previously, there were those 3 buckets, the 3 eligibility timeframes. But with the safe opening and operations work eligible for public assistance with the most recent update, they had that policy supersede the previous one. So that policy now allows and is in place throughout the COVID-19 disaster.
Next question is, does IEM help differentiate for the counties, should they contract with IEM, the various federal funding streams such as ARP or the stimulus funding programs that were put out to the communities in 2020 and 2021, and help differentiate between the FEMA and the other federal funding streams?
We absolutely can. FEMA reimbursement as and of itself is part of that Category Z management costs. If there is any assistance, any technical support that we can provide with the American Rescue Plan Act or with any of the other federal funding streams, we are happy to do that as well. We've provided that to numerous communities. There's one community where we're assisting with there's several communities we're assisting with public assistance, wrapping up CARES and preparing for CARES Act audits, and then also preparing and assisting with the American Rescue Plan Act as far as expenditure and eligibility review through to creating programs and helping to document the, for instance, small business loans that they may be providing their community, walking through that application process.
Okay, we are coming up on the hour. I want to thank you, Michelle, for your fabulous presentation. Thank IEM for customizing this presentation for New York County use. Again, we are going to post this on our website later this afternoon. We did have a question if other entities could use this PowerPoint and this information. Yes, the answer to that is your non-governmental organizations or not-for-profits which are assisting the county and your communities. Yes, you could share this with them, and yes, they can also contract with IEM. That is something that they would look at as well. And I want to thank really everything, including NYSAC, our sponsor for today's program. We did have one last question come in here. I thought earlier webinars said that FEMA was the payer of last resort. Has that changed now? Is FEMA the payer of last resort is the question. And then the follow-up question. The follow-up question to that is, please relate FEMA to Public Health Article 6 funding, which is a state public health program for funding state public health funding.
So FEMA is typically the funder of last resort. However, with the updated policies regarding COVID-19, they recognize the various funding sources, and they, for this specific disaster, are not the funding of last resort. They're encouraging communities to consider all the different federal funding sources that are available, and to make that make the best decisions for your community so that you can respond and recover and begin to build back in the most efficient and effective way possible. I will have to look further into the state public health funding that's available, and Steve, I'm happy to provide feedback on that.
Okay. I really want to thank you, Michelle, and thank you, Diane, for sending that note in about FEMA being the payer of last resort, a very important qualification just given there by Michelle that has in fact changed. I want to thank NYSAC, our sponsor. Look, folks, we did this because we want to make sure that all counties, the largest of them, including the city of New York, the Long Island counties, also the smaller counties all across the state have access to this federal reimbursement program. And we're really grateful again to IEM for putting this together for us. This will conclude today's webinar. I want to thank everybody for joining us today. Keep safe. Thanks for all you do to keep New York safe.